for SHM Health Service Management Field Program. So we are where?
We are
Lalgadh. We are at Lalgadh Hospital. So today is day one. So today is day one. So everyone is having fun and exploring the beautiful Lalgadh. So hello guys and welcome to my channel. I am Suveksha Shaha, a 4th year MBBS student at Tribhuvan University, Nepal, and today I'll be sharing with you a day in life of a 4th year medical student in Nepal. We are in Health Service Management Field Program and we are posted in Lalgadh Leprosy Hospital. So today is the day 1 and I'll be showing all the tour of Lalgadh Hospital. So this is the main OPD building, and you can see the main outpatient departments. There are many rooms allocated. There's a beautiful chautari for sitting area. So let's go inside. So this is outpatient department. We are going inside. So you can see there is ample number of patient. So this is consultation room number 23 and we are going ahead, and there is 2 more consultation room there, and we are just moving forward. It's just a beautiful place. This is Prayogsala, which is also known as laboratory, where all the testing, blood test and all the other tests happen. And this place is so beautiful, and this is the USAID. It's run by USAID also. This is maternity area, which is built by Robert and Stratton Foundation by their donations. And this is the pharmacy unit where all the medicines are dispensed, and you can see patients are coming and receiving their medication. And here is children unit. There are many wards allocated. There are male ward, there is female ward, and there is children unit male, there is children unit female, and it's just so peaceful and beautiful. So this is the typical ward of the Lalgadh Hospital. So there is male ward, female ward, and adult male ward, adult female ward, and there's many nursing stations as well. So there are so many patients. I could not show you more because of patient privacy, but this is how it looks like overall, and such a beautiful place to be here at. And as you can see, there is one fountain. I really liked it, and I'm just exploring the beautiful Lalgadh, and today's day 1. So you can see this is rehabilitation center, the socio-economic rehabilitation center, and just in besides socio-economic rehabilitation center, we have community based rehabilitation center as well. And now I'm going upstairs, so let's see what's there in upstairs. So I'm moving upward, and I really am enjoying this beautiful place. The hospital is so nice. So in above the rehabilitation center, we have Talim Kendra, which is also known as training center, and where this is a place where we will also be trained for health service management program. And we are just exploring. So this is another place. This is ticket counter where patients are taking their tickets for outpatient. And this is the consultation room number 7, and we were posted there as well. We just finished with OPD consultation. हामी 11 to 12 सम्म चाहिँ OPD मा बसेको थियौं, अनि हामीले डाक्टर केपी ढकाल सरको अन्डरमा हामी बसेको थियौं, अनि इट वाज रियली नाइस. हुन्छ नि, अब हामीले डर्माटोलोजी बुकमा पढेको कुराहरू आफैले डायग्नोसिस गर्न पाउँदा चाहिँ इट वाज रियली गुड एक्सपिरियन्स, टु बी भेरी अनेस्ट. होइन, हामीले चाहिँ टेनिया कर्पोरेस डायग्नोसिस गर्यो, अर्टिकारिया डायग्नोसिस गर्यो, अनि one patient had came with itching, अनि त्यो पनि हामीले डायग्नोसिस गर्यो, अनि इट रियली फेल्ट गुड. हुन्छ नि, हामीले बुकमा पढिरहेको कुरा यसरी डायग्नोसिस गर्न पाउँदा. सो इट वाज रियली ग्रेट एक्सपिरियन्स टुडे. सो हामी चाहिँ पुरै लालगढ हस्पिटलको चाहिँ राउन्ड गऱ्यो होइन वी जस्ट भिजिटेड अल दि लालगढ हस्पिटल एन्ड टुडे चाहिँ वी गट अ रियली गुड अपर्च्युनिटी टु बी इन अ कन्सल्टेसन अन्डर कन्सल्टेसन अफ डक्टर आरपी ढकाल सर अनि उहाँको अन्डरमा चाहिँ हामी ओपिडीमै बसमा चाहिँ हामीले टेनिया कर्पोरिस डायग्नोसिस गऱ्यो होइन अनि आई फेल रियली गुड हुन्छ नि जब वेन आई स द सेम थिङ द्याट आई रेड इन द बुक अनि त्यही कुरा पेसेन्टमा हेर्दाखेरि र डायग्नोसिस दिँदाखेरि टेनिया कर्पोरिस हो भने डायग्नोसिस दिँदाखेरि चाहिँ सो मच थिङ है एकदमै कस्तो अर्को ह्याप्पी फिल हुँदो रहेछ है अनि त्यसै गरी हामी अरू के हेऱ्यो हामीले एक्युट अर्टिकारिया क्रोनिक अर्टिकारियाको पनि क्रेसेसहरू देख्यौँ एउटा अनि एउटा पेसेन्ट चाहिँ एकदम एक्सेसिभ इचिङ लिएर आएको थियो पाम्स र सोल्समा अनि त्यो पेसेन्टलाई पनि हामीले हेऱ्यौँ सो इट वाज रियली फन एक्सपिरियन्स टुडे सो डे वान वाज सो फ्रुट so lots of hard work was done to make this video and if you want to see further medical content like this do like share and subscribe to the channel thank you so much for watching